मुझे कोई क्वेश्चन नहीं पता। यानी आप सर समझ गए होंगे, आप पहला स्पीकर कोई क्वेश्चन नहीं पता क्या पूछा जाएगा, कुछ नहीं आइडिया है। यानी हम महान धार्मिक धर्म की भूमि की नगरी, भारत की महान बेटी कल्पना चावला की जन्मस्थली व हमारे संस्थान में आप सबका हार्दिक स्वागत, शुभकामनाओं के साथ हार्दिक अभिनंदन। Director sir, who gave the permission for all the events for workshop cum CME, and my respected teachers, Dr. J.C. Fasi sir, and dear students, I welcome you all to this hall on my behalf as well as on behalf of my institute. I congratulate Dr. Ashok, Dr. Vikas Dilo, Dr. Swati Arya for organizing this wonderful workshop cum CME, to which myself and director was witness yesterday, and we watched the live workshop for about 15-20 minutes, and it was a very nice experience. The surgeon was operating and there were around 20-30 students who were watching in the demonstration room adjacent to the operation theatre. And I also welcome all the student volunteers who have helped the Department of ENT organizing this workshop cum CME in a very nice way. And their dedication was par excellence. So kudos to the student volunteers, to the Department of ENT, and I conclude that this event will be an inspiring force for other departments also to organize such academic activities in future. Thank you all. Jai Hind, Jai Bharat.
Thank you, sir.
I forgot to welcome sir, Dr. Sir.
I would like to request Dr. Satish Bhatta sir, Haryana Medical Council observer, to kindly give away his observations.
आज की सुबह आप सभी लोगों का, मेरे सभी डॉक्टर साथी, मेरे कोलीग्स, मेरे जूनियर्स, कुछ चंद लोगों को छोड़ के सभी मेरे जूनियर्स हैं, और उन सबका मैं आज, जैसा कि डॉक्टर साहब ने कहा, कर्म की भूमि करनाल नगरी में मैं भी आपका सभी का स्वागत करता हूँ। और मैंने कल भी चीज़ों को ऑब्जर्व किया, बहुत अच्छे ढंग से इस कॉन्फ्रेंस को कम वर्कशॉप को अरेंज किया गया है। उसके लिए सभी ऑर्गेनाइजर्स बधाई की पात्र हैं। विशेष तौर पे डॉक्टर अशोक एंड हिज टीम बहुत अच्छे से सब ऑर्गेनाइज किया हुआ है। और मैं और तो क्या कहूँगा कि बीइंग ऑब्जर्वर, आशीर्वाद आप सबके साथ है, और मैं चाहूँगा कि आने वाले समय में ऐसी ही कॉन्फ्रेंसेज होती रहा करें, क्योंकि अब बदल रही हैं। पहले हमारा ये कंटिन्यूइंग मेडिकल एजुकेशन केवल हुआ ही करता था। हम क्या करते थे कि हमें कंटिन्यूइंग मेडिकल एजुकेशन का मतलब ये हुआ करता था कि हम जाएं, खाएं, पिए, एक आधा लेक्चर सुने और घर वापस आ जाएं। पर अब स्थितियाँ बदल रही हैं। अब हमें बेसिकली जिस पर्पज़ के लिए चीज़ बनाई गई है वो करना है, सीखने के लिए ही करना है, हमें अपने आप को रिफ्रेश करने के लिए ही करना है। कंटिन्यूइंग मेडिकल एजुकेशन का मतलब ये था। अब नेशनल मेडिकल कमीशन ने इसका नाम भी बदल दिया गया है, तो वो CPD कर दिया उन्होंने, कंटिन्यूइंग प्रोफेशनल डेवलपमेंट। तो उस नाते से कुछ चीज़ें बदली हैं। अभी NMC की जो लेटेस्ट गाइडलाइंस थी उनको होल्ड कर रखा गया है। तो जब आएंगे उसके हिसाब से हमारे जो क्रेडिट आवर्स हैं वो भी बदलेंगे। पहले क्रेडिट आवर्स कम ज़रूरत थी, अब हमें ज़्यादा ज़रूरत पड़ा करने के लिए। तो इसलिए इन सभी कॉन्फ्रेंसेस को हमें सीरियसली ऑर्गेनाइज करना होगा। और आज की इस कॉन्फ्रेंस से मैं पूरी तरह से संतुष्ट हूँ कि सब नियमानुसार इसको किया जा रहा है, उसके लिए सब आप बधाई की बात है। थैंक यू।
Thank you, sir, for your good wishes. Now, I would like to request Dr. Ishwar Singh, Medical Professor ENT, Medical Director, Indira Gandhi Hospital, Dwarka, to kindly address the guest.
Good morning, everyone. Respected, or I'll say, colleague of mine, Dr. Tereja, Director Kalpana Medical College, my seniors, Dr. Desi Pasi, Dr. my classmate, Umaga, and other respected technicians. I congratulate Dr. Ashok Jaglan to organize this talk, and it's quite heartening to see so many faces, and it will be useful and beneficial for the juniors to see some senior stalwart to operate. I can see my junior Dr. Amni also there, and Dr. Raman and other faculties. So it's a maybe step in the right direction, and hope you organize many more, and one day it should become a state event and maybe national. With these good words, I congratulate the organizing team for calling me, and all the best for this such a lovely event. Thank you so much.
Thank you, sir, for your words of encouragement. Now, I would like to request Professor Vikas Kakkar, sir, Professor and Head ENT at NJ University, to kindly share a few words of wisdom. Sir, please.
Good morning to one and all. Respected dignitaries on the dais, off the dais, colleagues, heads of various departments, my students. First of all, I will say I'm not a guest, I'm a host. Let me assure you how honored and privileged I feel to be a part of this conference. I congratulate Dr. Ashok and thanking him for inviting me and making me a part of this conference. The success of any conference depends on the organizing team. Team itself says together everyone achieves more. So we and probably we are the best team with him, and I can see your efficiency, Dr. Ashok. I put these with you. I am going to assign you certain duties for the Haryana State Best Conference also. So, we all know that medical science is progressing at a very fast pace. And it is only at these conferences and interactive sessions that we get a platform to share our knowledge with fellow colleagues. And it really helps the knowledge to populate at all levels. I request all the both present here, being the surgeon, I request everybody to become members of the Haryana State Association. The Haryana State branch was constituted in the year 1996. And after that, we have been holding the state conferences every year. This year, the Haryana State branch conference is being organized at Dept University on 25th and 26th of November. I invite you all and participate in full strength and make it a grand success. Once again, I thank you for the endearing hospitality and the thanks all.
Thank you, sir. World College of Medical Sciences and Research will enlighten us with your presence.
Morning to all. The Director of Chawla Medical College, Karnal, Dr. Tereja, came to know he also comes from the same institution, that is PGIMS Rohtak now. Sanjaypal, our medical superintendent, Dr. Satish Kakkar, ever young looking member of Haryana Medical Council, and above all, my batchmate. We are 1974 admission batch of then Medical College Rohtak. It was used to be called as only Medical College Rohtak, not Pandit B.G. Sharma. This name came quite late. We have other senior faculty, guest faculty for this workshop. Dr. Vikas Kakkar, Dr. Ishwar Singh, Dr. Umagar, Dr. Ram Sharma, Dr. Avni Jain, Dr. Preeti I met today, and one more smart lady sitting in the corner, I still don't know. Yes, I am talking about you. Oh, great. So this is the popularity of our Dr. Ashok Gaglan that speaks in itself that we have people from so many other specialties, faculty members of this college joining this function today. I also want to address the delegates and above all the undergraduate medical students who are present here in large number. It's a very good sign, very positive sign. But before that, I want to extend my gratitude to and his team, Vikas Dhillon and others, whom I don't remember by name, for organizing this first workshop cum CME on a very modern subject of coagulation and endoscopic surgeries. Dr. Satish Kakkar, Dr. Vikas Kakkar and Dr. Ishwar Singh will agree with me when we started ENT as postgraduate students at Rohtak. I must admit that these surgeries being done at that time were not result oriented. Since it was not result oriented, it was not a preferred subject at that stage. But now things have been revolutionized. Now ENT is a sought after subject not only in developed countries but also in India and other developing countries. Because you don't have to do an MCH and spend 3 more years after that, though you can still do MCH in plastic surgery if you are a postgraduate in MSc ENT. This is for the undergraduate students to understand. And then it is a very neat and clean area of the body which you deal with and not very great emergencies, so your life is also comfortable, unlike gynecologists. So, continuing with the effort put forward by this Dr. Ashok Gaglan, Vikas Dhillon and team, I must congratulate them for initiating this process, especially the live workshop. This is very important but very difficult to organize. So I have to extend my thanks to the administration of this college as well, who must have helped him to organize this wonderful, lively surgical procedure that you are witnessing since yesterday. And I am told that these surgeries were very excellent procedures were done. The good thing is, Dr. Dureja and Dr. Vijay, that your ENT faculty is quite young. They are young, they are enterprising. It's a very, very good sign for the department of ENT. I wish Ashok and Vikas continue in this institution for the further development of the department of ENT. And they also have a potential to be involved in your administrative responsibilities of the college as well. Of course, that is up to you to decide. So, Ashok, keeping your yesterday's performance in mind, I can say that the future of ENT in Haryana is bright. You continue doing this Haryana State Conference for the year 2023 at Gurgaon. Definitely, Ashok should be involved and given some responsible task because his trailer is so good here. That's good. At World College of Medical Sciences and Research, Chhechar, where I am also the dean cum principal of the college, I am going to organize temporal bone and lateral wall of the nose workshop in the month of January 2004, and also aspire to organize the annual conference as well. I will like all of you to be involved, of course. So, finally, what I want to convey is that ENT for undergraduate student is a very good upcoming branch. For postgraduates, this workshop which is showing you the procedure which are modern, which are endoscopic and coagulation kind of assisted surgeries. This is not that this kind of thing is shown everywhere. So you are all are lucky to have been invited to see this interesting procedures here, along with of course the scientific lectures. So I once again congratulate and also thank Ashok for inviting me, also because I will be able to visit my hometown, which is Yamunanagar, and Karnal happens to be the midpoint. Thank you very much.
Thank you, sir, for your words of encouragement. Now, last but not the least, I would like to request our worthy director and chief guest of this event, Dr. J.C. Dureja, sir, to kindly address the gathering and encourage the organizers. Sir, please.
First of all, I would like to thank Dr. Basil for saying kind words for the institute as well as the department. Very kind of you. Dignitaries present on the dais, our medical superintendent of the institute, Dr. Vijay Pal, Dr. Steve Becker, who is HMC observer, as well as my PT mate during anesthesia post-surgery and DAMS Rohtak, Dr. Sakar, Dr. Ishwar, my teachers, Dr. Pasi, Dr. Uma, whom I have worked more than 4-5 years at BPS GMC Kanpur, other invited faculties, our KCGMC faculties, various professors, Dr. James Carey, Dr. Prerna, Dr. Hemlata, Dr. Ruchi, Dr. Patia, and I cannot recall all these things. I first of all like to say a very good morning to all of you. And secondly, it gives me immense pleasure to welcome as well as thank for attending this conference and sparing your valuable time to make this conference or CME become this live workshop success. I can see a large number of students in the class, and I would like to say that now the learning as well as teaching is made very simple. In our time, I remember that we used to learn from our teachers in the form of lectures, and if suppose we have to write a paper, we used to visit National Medical Library frequently, spending so many hours waiting for photocopies copies and getting them in the evening and coming late so many times. And suppose if we have to present a paper, then we used to call the photographer that you must be remembering कि वो आते थे अपना फोटो लिया, they prepare the negatives, they mount it, and after 3-4-5 days they gave us the 20-25 slides. And this was the way our learning and teaching. Now this CME and everything is available on the net in the form of the e-book, teaching as well as learning material. very much difficult at our time. Now, it is the another demand of our profession that we have to keep ourselves updated. So these CME, these live programs, they are the two methods which help us not only to enhance our knowledge, at the same time we can also share our knowledge as well as experiences. Now, to organize this conferences is not a very simple task. As Dr. Pati said, to organize is not an easy task. So it needs dedication, it needs cooperation, it needs help from the other departments also. I appreciate the cooperation which was extended by the Department of Anesthesia to make this conference under the headship of Dr. Korea, to make this conference cum CME successful. I have also been told that more than 170 they have been registered from the various parts of the country, including Karnataka and UP and Bihar. And another important thing is that all the medical colleges of Haryana, including the government aided as well as the private colleges, they are participating in this conference. This is a very good achievement of this ENT workshop, some live surgical procedure workshop. So it is all the medical colleges, either 1, 2, 3, all the faculty members or their members, they are attending this conference. And at the same time, the HMC has granted 8 credit hours. I thank Dr. P. Shatter for granting us 8 hours from the HMC. Friend, this ACGMC is a government organization and it is a state-of-art hospital and it is committed to provide best healthcare to all. And its OPD attendance is around 2,500 per day and more than 500 to 600 deliveries they are being conducted in a month. At the same time, more than 600 surgeries they are also conducted in a month. And at present, it is a recognized medical college with an annual intake of 120 medical MBBS students. And postgraduate courses they are also available in pre and paramedical subjects. We have MD courses and in the clinical subject we have DMP courses, spanning 2 departments in which the faculty is not adequate. Otherwise, all the specialties they are having postgraduate courses. In addition, we are also running the paramedical courses like PSC OT technology, PSC optometry, and PSC lab technology, and as well as PSC radiography. Another one thing which is important about this conference, I think Dr. Ashok is here. We have not asked any financial support from the administration. And conducting a live workshop without financial assistance is a great achievement of the department. So, finances they have been procured from the administration. So this workshop is conducted almost finances which have been arranged from the delegates. So I would request the other head of the department also that they come forward and arrange such type of the conferences. CME, as Dr. Khatter has already said, that more and more number of the conferences they should be conducted, and our focus will be more on this live workshop and procedure rather than conducting the lectures. So we will try to follow in the NFC guidelines rather than going to the previous one. So at the end I would like to say that by participating in this that the knowledge in this subject will be enhanced. And after attending this conference, we will be in a position to serve our patient and the humanity in a better way. Thanks a lot.
Thank you, sir, for your kind and encouraging words. It means a lot to us. Now I would request Dr. Ashok Kumar, sir, to please come on the dais. He would like to make an announcement.
Sir, with due permission of our chief guest, Dr. Jagdish Chandra sir, I want to inform in our CME we have proposed 20 hours of teaching session, including 6 hours for PGs only, PG sessions only, sir, and remaining for faculty as well as PG, sir. With permission of our observer from Haryana Medical Council, I would like to take permission and announce an additional webinar for our resident students on same topic only from one of my senior who is working as head of the department at Manipal Institute at Mangalore. He has agreed to use his resources from his institute, his department, and he will conduct a webinar for our delegates in this venue tomorrow morning from 9 to 9:40 a.m. sir. Before starting our routine sessions, 40-minute session has been as a surprise gift for the delegates who have cooperated with me to come at short notice. This is an additional perk I want to give them to attend this webinar. Otherwise, most of the webinars from that institute are of private type and paid type. This is free for us in addition to all the things which we have organized. I want to seek permission from the authorities as well as sir for add this on to our this thing. Thank you very much.
Thank you, sir. Now we are almost at the end of the ceremony. I would like to start the felicitation ceremony. First of all, I would like to call upon...
Can I just interrupt you? One thing I forgot to request our worthy director of this college, that we do not have PG course, MS ENT yet here, though you have in other subjects. So I, on behalf of the entire Haryana ENT Surgeon Association, request you kindly be in touch with NMC.
The only constraint by Professor of Different Assign of that is less number of faculty. There is only 2 faculty, Dr. Ashok and Dr. Dept. That is
your job na